Hearing loss can be diagnosed in various ways, like pure tone audiometry, BRR, ESSR. In children, we can do BRR or ESSR. In adults, we can go with pure tone audiometry. Once a proper diagnosis is made, the type of hearing loss and the degree of hearing loss is assessed, a proper management protocol can be based. In children, if there is a complete hearing loss, or in senile hearing loss, those above such 60 years, 70 years who are having hearing loss, we can go for cochlear implant. In other cases, where there are some other components, we can prescribe hearing aids, we can prescribe other form of surgery and can cure the hearing loss.